and speak to the programs and the opportunities that are happening across the state through the Office of Substance Abuse Mental Health. And that will take me into the next slide, which is the disclaimer. No relevant financial conflicts of interest to disclose. Many of the programs resources discussed in this presentation are supported through federal funding administered by my agency. So when I say my agency, that's DHS as a whole. And I will say that kind of what Dr. Coker had said, that there may be a lens of bias based on that, but I do have a couple of resources shared that are being currently funded through a federal program called SOR, State Opioid Response Grant. So just giving you that heads up. The content presented reflects my professional expertise and intended solely for educational purposes. I am like multitasking right now, so if you see me look weird, it's because I'm trying to move the screen around. Okay, so please get your phone out because this is going to be, every slide will have QR codes. And I want to share briefly about why I'm doing this, because this call is so cool that it is around resources. I am not an expert in research. I'm not an expert in the medical field. However, I do see some gaps from this public space that I work in regards to education and understanding awareness around substance use and pregnancy, as well as substance use and then postpartum. I mean, I think that is evident across the board that there's so much information that is being researched and published, but it's about getting that word out to the people that are working every day in this space. And so it's kind of becoming part of my mission, is to be able to share that I have one research that I may be presenting today, but I promise that if you were to Google more, there's so much information that's being done right now in this space specifically. And part of what I want to talk about are myth busting about working with women that are pregnant, working with that postpartum population. So just looking at this slide here, we have this AMA, the American Medical Association, in collaboration with that organization. I don't know, Manat Health released a new report, this recommendations for state policymakers to improve access to evidence-based care for pregnant and postpartum women. So again, if you get your phone out, you open up your camera screen, you should be able to hover over it and it will give you a link so that you can actually download that, or it'll take you to it. These slides will also be sent out after this call, so they do have access to that. I have my email on the first slide. I'll share it in the chat. Okay, so Governor Sanders established a committee and initiated a 6-month timeline to consider potential reforms that she signed into executive order, Support Moms, Protect Babies, Improve Maternal Health, on March 6, 2024. So that is available here. This is the Healthy Moms, Healthy Babies initiative. It would be a disservice of me not to mention this, because I am a part of DHS, that there is a plan of action to improve access to care for our maternal health initiatives. And so if you are interested in learning more about that, I do have that in that second QR code on the right. This is another QR code for the Office of Substance Abuse Mental Health. As Kim mentioned in the previous presentation, she said that there are trainings that are going to be distributed to the prevention providers across the state. And if you're not a part of the prevention network, you may be like, what is that? What does that mean? And as you know, if you've worked with DHS, we have 100 different maps with different regions, all labeled different things. I love that we do that because it makes it really hard to keep track of everything. So that was sarcasm. It's not one map for one division. It's very several across the whole network. I say that to say this QR code is going to take you to our website that has these maps listed. So if you want to know about where you can access substance use disorder treatment, residential treatment, it is free to the client if they are underinsured or uninsured. So we have that's a map with the list of providers on this website. There's also the map for specialized women's services that I'm going to share more about. That map is on this website. Prevention providers, prevention means before drug use or potentially preventing continued use. They have an area, a region map that is available on this website with contact information for the people in your area of the state. So as Caitlin was talking about, getting in and talking with some of these providers is such a key part, because there's a lot of work and resources that are probably in your area. And if you are not familiar with it, those are the people, those prevention providers, those treatment centers, those are the places that you can go to learn more about what's available in your area, because there's most likely some resources. It is a statewide initiative, so that hopefully every region, every county, every city is going to be covered with something, whether that's you want free naloxone, overdose reversal medication that you want to hand out. If you want to learn more about where I can get medication for opiate use disorder, all of that information is on this website. So please take use of this, take note of that. If you were to just go to the DHS main screen and try to find and navigate that website to find OSAM, I am just going to give you an award. It is a difficult, it's difficult to find our website. So using this QR code takes you right to what you need, and I suggest you use that. If any of these QR codes are not working for you, please say something in the chat, and I can try to get that after the talk today. Okay, so as mentioned, here's more information about the SWS treatment contracts. So this is Specialized Women's Services. This is pregnant women and then women with dependent children who are experiencing issues related to substance use disorder. And they are sometimes referred to these treatment centers by DCFS because maybe they have a case open and the courts decided that the courts, as well as the assessments done, decided that it would be a good fit for them to go to treatment, or that they need some kind of support. So they will reach out to these treatment centers. They'll do a clinical assessment upon admission. And then if they're a good fit, they will be entered into treatment. Okay, so what's really special about this, besides the name Specialized, is that you can actually take your child with you to treatment. You can take your child with you to treatment. And that is very unique in the setting. And I think a lot of women, especially, are hesitant to get into treatment because what about my kids? Now, there is a caveat to that, is that there is a limit. It's up to 2 children under the age of 7. However, many of these treatment centers are in this business for the right reasons. If there is a mom that has more than 2 children, they have 3, 4, whatever, the treatment center is going to find a way, hopefully, to take that mother in and either find necessary supervision for the children, as well as they will reach out to DHS and let us know, and we can approve that. So all they have to do is email us, hey, we have someone with more than 2 children. Is it okay if they come in? And 99.9% of the time, I'm going to say yes. So a lot of the times they will accept that mom with more than 2 kids. If they're over the age of 7, sometimes they take them in. And I also want to add is that a lot of our treatment centers will take what we call Garrett's Law referrals. Garrett's Law, as I know that many of you are familiar with, are mothers that tested positive or the baby tested positive for a substance, and they found it necessary to have this investigation into their situation. So a lot of these treatment centers are taking mothers that have fresh born newborns and going into treatment. And I kind of want to walk through briefly what this looks like. You have a newborn, even if they're in the NICU, these treatment centers are working with the mothers and the caseworkers on the DCFS side to assist in helping this mother stay in that child's life, because the goal is to keep them together. And they work with the mother to help support her recovery journey while she's also going through this whole process of being a new mom. I did a site visit recently to the location in Hot Springs. They had probably, I think it was about 5 newborns because of the Garrett Law referrals that were happening at that time. And so what happens is they have a nursery or a daycare where they are watching the babies during the day. Let's say it's 9 to 4 while the mothers are in class. They're doing group therapy. During their breaks, they're going to come in and be with their babies during that time. And then when they're finished for the day around 4 o'clock, they come back into the cottage and the daycare to get their child, and they begin their night routine where they're going to do dinner, they're going to do bathing, they're going to do all those things with support staff to help teach the mother about the importance of having a routine, with teaching them about the importance of connection and being present with your child. And if you are coming from a space of substance use, if you're coming from a space of domestic domestic violence, any of those types of situations, having that support staff there to walk you through those, what may look like very basic things, is actually huge, right? That is a huge part of the process for that postpartum period, is like, let's get back on track with getting this routine down so that we can help take care of the child, help take care of the mother. Because when I know that when I'm doing a good job as a mom, my esteem, all that stuff is going to start hopefully building. And then I have support staff there to work with me in case I have questions or if I have any issues. They're in treatment, they're in therapy, so they have access to a counselor. Some of our centers, depending on their staffing, they may have access, hopefully, to an APRN. They'll have access to a medical director of some sort, and they're going to be able to do the necessary things for their own mental health. And part of the initiatives moving forward into 2026 is to really focus on, well, what happens after they're ready to leave SWS. These treatment centers per contract are up to 120 days. Sometimes it may be 3 months. Sometimes it might be 1 month. It really just depends. It's case by case on the mother and her circumstance. And they try to work with her on the discharge planning. And so the next steps into 2026 is going to focus on the discharge planning and seeing what is in her community when she gets out and she's ready to live a life, in recovery with her children. Okay, so these are new slides. If you've heard me present, I've talked a lot about SWS over the last couple of years, but this is the stuff that I'm really excited about moving forward into my own personal career, as well as in this space particularly. So some myth busting. Again, I have the resource available, QR code. This comes from the SAMHSA website. I don't know why they didn't put a year on it. So I tried to put like what year this was made. It didn't give me that option. So I just want to talk about what are options for mothers when they come in and they are pregnant. And so as we see here on the left, some of the do's. Ask the risks and benefits of taking one of the medications for OUD during pregnancy. Now, what that means, opiate use disorder, OUD. There is a big, myth about taking certain medications when you're pregnant. And as we go over to the right side, don't consider changing your OUD, that's opiate use disorder, medication unless you are taking naltrexone, which has not been studied in pregnancy. Changing your OUD medicine may increase your risk of returning to substance use. Don't let your OUD go untreated, because you want to prevent your baby from experiencing that's neonatal. I'm sorry, y'all. Is there a doctor on the call that could help me? Neonatal AS. What does NAS stand for? Anyway, that is, if anybody has that, knows what that is.
I think it might be neonatal abstinence syndrome.
Thank you. Neonatal abstinence syndrome. Perfect. See, this is like a collaborative call. Okay. Treatment medicines can be used safely during pregnancy. Dosing changes will not change the risk or severity of that neonatal abstinence syndrome for your baby. So I kind of want to put this into layman's terms for myself, is that if I have a substance use disorder, and just for people on the call, if you didn't know, I am a person with lived experience. I have experience of being a mom on drugs. So this really runs very close to my heart. Being a mother on drugs is something that it's not that you don't love your baby. It's not that you don't feel like you are, you may feel a lot of shame and guilt around the situation. I know that I did. So when I am on, let's say, substances like opiates, that would be like a Roxy, a Hydro, fentanyl, all those opiate pain medications, there are options available. If I were to try to get off that medication, if I had a high dose of it, if I was doing it regularly every single day, I run the risk of going through withdrawals, which would then potentially put the unborn fetus into some kind of medical crisis. Okay, and so this idea of like, well, I need to quit because I'm pregnant. There are options that are available to mothers. And that's what a lot of our talks are about today, is that whenever you come across a mother that's on any kind of substance, is that being able to provide options to her, to let her know that, yes, there are things you can do during this time. So another example I want to give, or another kind of scenario, a mother comes in, she has a substance use disorder. That's like, I think we call it comorbidity, right? She's pregnant and she has a substance use disorder. And I think moving into 2026, we can also say that I can treat both at the same time. What what an amazing concept for me is that we can treat both at the same time. I'm not going to treat just the pregnancy and work with just the pregnancy and ignore the substance use disorder, because unfortunately what happens is maybe she gets clean or she stops using drugs during her pregnancy. When she gives birth, now we're going to have to deal with all of the stressors that's happening in life, and you're going to see such a high lapse of high you're going to have such a high risk for relapse or returning to use, which then can contribute to all the issues that we've talked about already on this call. So that is like it's a medical condition that we can treat even while they're pregnant, and that will also create that safety net when they give birth. As they're moving into the next stage, is they have already developed some coping strategies so that whenever they are now a new mom, they're going to be able to use that tool, the medications or the therapy or whatever they had going on while they're pregnant, to use that and address those issues after. Something that I think is sometimes overlooked. We look at overdose rates. We look at the risk of overdose. I want to have an open question here, but do you know what is the highest time, the most dangerous time for overdose leading to death? What period are you most at risk for dying from an overdose? And that is going to be after a period of abstinence. Okay, so I have friends, I have people in the community that are constantly having to report back that there are people dying often from overdoses. And what's really staggering are the amount of people that have either just gotten out of rehab, they've just gotten out of treatment, they have a period of abstinence, or they just got out of jail. So let's think about our pregnant mothers. They quit using drugs because they quit using substances because they are pregnant, and they come home with their baby and they have these stressors. So they've had a period of abstinence and then they return to use. It's the most dangerous time for that to be fatal, because your body does not have the tolerance built up that it had before. And so that medication or those substances that you use, unfortunately, your body, it results in an overdose, and you don't have the tolerance built up for that opiate, and unfortunately it can lead to death. And so that's why it's so important for us to talk about tools during pregnancy, tools after they get out and they've actually given birth, to provide them with resources so that doesn't lead to a fatal overdose once they've given birth. So that, I feel like I'm still trying to workshop this and to make it sound very professional, but it is something that I'm passionate about, because I think people forget that just because they don't use while they're pregnant does not mean that after the baby's born that we can just like let them go, they're good, they've healed, they don't have a substance use disorder. But unfortunately that still happens after the baby's born, and I can attest to that personally. Okay, so here are some more resources. These are some studies that were done. Of course, these look a little old because this research has been going on for a while. You are more than welcome to download these. But what's good about this is that you're going to be able to find this as a starting place for some of these researches. You're going to be able to find so much more that's happening in the field. It's a common misconception that pregnant women can't be on any kind of opiate dependent, any kind of medication for opiate use disorder. You can totally do it. It's FDA approved at this point. There's many different options for that. Clinical care for opiate use pregnant and postpartum women, the role of obstetrics and their providers. That's a great resource if you want to learn more about how we can be a part of the process and recovery for our pregnant women. And then the last one is, oh my goodness, breastfeeding, right? Tip 21. This is something that is being revised. It's been revised recently. And so if you have mothers that are in that substance use category and they have been on medications for substance use disorder, they can actually still continue to breastfeed even when they're on the medication, because again, whenever you are getting off that medication, being without it can cause symptoms of withdrawal, which can be dangerous to the baby. So maybe that trace amounts, there's a lot of studies around this. I'm not just making it up. Luckily, there are research that can back me up on what I'm saying. You can actually continue breastfeeding while you're on certain medications. I'm not going to say it's a blanket statement that it's every medication. You really have to work with your doctor, obviously, and being able to know which medications are safe during this time. Okay, so here are some current projects that are happening at the Office of Substance Abuse and Mental Health that they've supported through federal funding. I mentioned that at the very beginning. We do have the River Valley Medical Wellness. That's Dr. Martin. Her brick and mortar locations are located in Russellville, that's Pope County, and also Hot Springs, that's Garland County. They are a primary care clinic. However, with the help of some other funding sources, they have a mobile health clinic. So with a project that we started last year is that we supported the purchase of ultrasound equipment to put inside these mobile clinics. So let's say they go to a site in Hot Springs or they go to a site in Pine Bluff. They will station their mobile health. They will announce it in their listserv. They will announce that they're going to be on this day during the month. Every month, they will be stationed at the parking lot of Walmart from 9 to 4. I'm not really sure exactly how that works, but they have that listed on their website, I believe, information to learn more about their schedule. But they will be there with ultrasounds available. They have medical staff on board. They have peer support staff on board. They are trained in a lot of different screening tools like SPERT, and they will do just that initial ultrasound. They have their equipment to do that training, then send the ultrasound, especially I think to read the ultrasound, they send it off, they get it read or they read it. And then if there's something that's of high risk, certainly, then they will work with that patient to defer them or to triage them to the next level of care from there. But what's great is that they're going into a lot of these rural communities to support some of these women that are coming on board. And I just, it's new, it's just getting started. So I just wanted to at least give that here as a resource. Another one here is the in-home care model to serve women eligible for SWS services. So as I said before, we're looking at the discharge planning from treatment. So as the mothers have been in residential treatment, which is like, we call it residential, it's while they're actually in a facility with their children during receiving substance use services, they're going to, discharge back home. Now we're focused on that step where we have in-home services coming in and we're working with the mother and her family, whatever her family looks like, and being able to work with them for the next kind of like as a step down level of care, kind of outpatient setting, to work with them on their skills and helping them with case management, with trauma therapy and peer support. All of those different levels are being brought to the home and working with a mother in the home and their family. So that's a really great project that's starting. I gave a QR code here to the foundation that is actually in Arkansas now, training staff currently to get this model started, and that will start in 2026. Very excited about that. A lot of intensive in-home services are already available, but this one is unique because it adds the recovery piece to it. So not only is it doing behavioral health, it's also addressing recovery, which is substance use related. So it has that additional service. Most of the time, in-home services will identify that substance use is a problem in the home, but then they refer out for care. But this one is actually going to be able to treat it in home as one big model instead of having to refer them. And actually, you know what? That's the end of the presentation. So I hope this information is useful.